I want to tell you about a patient of mine named Carol, 66 years old, retired accountant, grandmother of four, someone who by every outward measure appeared to be in reasonable health. She was not overweight. She did not drink heavily. She had no history of hepatitis. She exercised 3 times a week. She came to see me for a routine checkup and mentioned almost as an afterthought, almost apologetically, the way people do when they think something is probably nothing, that she had been feeling unusually tired for about 8 months, that her stomach felt a little off sometimes, a vague discomfort in the upper right side that she had been chalking up to indigestion, that her skin had seemed a little more itchy than usual lately, that a few people had commented that her eyes looked a little yellow, but she thought maybe it was just the lighting. She had been carrying these symptoms for 8 months. 8 months of her liver sending her clear, consistent, unmistakable distress signals, and she had missed every single one of them. Not because she was careless or negligent, but because nobody had ever told her what those signals looked like. When we ran her labs and did an ultrasound that afternoon, the results were deeply concerning. Carol had significant liver disease that had been progressing silently for what we estimated was 2 to 3 years. With the diagnosis finally in hand, we were able to begin treatment and slow the progression substantially. But the damage that had accumulated over those silent years could not be undone. Carol told me afterward, "I had no idea. I thought I was just getting older. I wish someone had told me sooner what to look for." And that is exactly why I am making this video today. My name is Dr. Sienna Black. I am an internal medicine physician with over 15 years of clinical experience. And today I'm going to tell you the 6 signs that your liver is in serious danger. The signs that Carol had and missed. The signs that millions of Americans over 60 are carrying right now without recognizing them for what they are. Please watch every minute of this video, and please share it with someone you love, because what I am about to share with you could change everything. Before we get into the 6 signs, I want to make sure you understand what your liver actually does, because I find that most people know almost nothing about their liver's function beyond a vague association with alcohol and detoxification. And that limited understanding is part of why liver disease so often goes unrecognized for so long. Your liver is the largest solid organ in your body, weighing approximately 3 pounds and sitting in the upper right portion of your abdomen just beneath your rib cage. It is also the most biochemically complex organ you have. Your liver performs over 500 distinct functions every single day. It filters every drop of blood that passes through your digestive system, removing bacteria, toxins, medications, and metabolic waste products before that blood circulates to the rest of your body. It produces bile, the substance that allows your intestines to digest and absorb fats and fat-soluble vitamins like A, D, E, and K. It synthesizes the proteins your blood needs to clot properly. Without adequate liver-produced clotting factors, a small cut can become a dangerous bleeding event. It produces albumin, the protein that keeps fluid inside your blood vessels and prevents it from leaking into surrounding tissues. It converts excess glucose into glycogen for storage and releases it back as glucose when your blood sugar drops. It metabolizes medications, meaning the effectiveness and safety of nearly every drug you take depends on your liver processing it correctly. It regulates cholesterol production. It stores vitamins and minerals, including iron, copper, and vitamins A, B12, and D. It breaks down old red blood cells and recycles their components. And it processes hormones, removing excess estrogen and other hormones from circulation. Your liver is not merely a detox organ. It is the metabolic command center of your entire body. And like your kidneys, which we have discussed extensively in this series, your liver does all of this without sending you pain signals when it is struggling. The liver has no pain receptors. It cannot hurt, which means that liver disease can progress for years, sometimes decades, before producing symptoms you can feel. And by the time symptoms appear, the disease is often significantly advanced, which is exactly why knowing these 6 warning signs is so important. Sign number 1 is fatigue, but not ordinary tiredness. I know that fatigue appears on virtually every list of symptoms for virtually every medical condition, and I understand if your eyes gloss over a little when you hear it. But I want to describe liver-related fatigue specifically because it has characteristics that distinguish it from general tiredness and from the fatigue associated with other conditions. Liver-related fatigue is profound. It is not the tired feeling you get after a poor night of sleep that resolves with rest. It is a deep, persistent, bone-level exhaustion that does not respond to sleep. Patients describe it as feeling like they are moving through water, like their limbs are heavier than they should be, like even small tasks, making a meal, taking a shower, walking to the mailbox, require more effort than they used to. This happens because the liver is central to energy metabolism. When liver function is compromised, the conversion of nutrients to usable energy becomes impaired. The clearance of metabolic waste products that cause feelings of heaviness and mental fog becomes less efficient, and the production of albumin and other proteins that support cellular function throughout the body declines. The result is a systemic energy deficit that no amount of rest can fully compensate for. In clinical studies of patients with chronic liver disease, fatigue is reported by 50 to 70% of patients and is frequently described as the symptom that most significantly impacts their quality of life. If you have been experiencing fatigue that has been gradually worsening over months, fatigue that does not improve with adequate sleep, that is accompanied by mental fog or difficulty concentrating, that seems disproportionate to your activity level. Please mention this specifically to your doctor and ask for liver function tests. Do not accept getting older as a complete explanation for this kind of exhaustion. Sign number 2 is jaundice, and this is the most visually recognizable sign of liver disease, which is why I want to explain it thoroughly, so you know exactly what to look for in yourself and in the people you love. Jaundice is a yellowing of the skin and the whites of the eyes caused by the accumulation of bilirubin in the blood. Bilirubin is a yellow-orange pigment produced when the liver breaks down old red blood cells. In a healthy liver, bilirubin is processed efficiently combined with bile and excreted through the digestive system. When the liver is damaged or when bile ducts are blocked, bilirubin cannot be processed and excreted normally. It accumulates in the bloodstream and deposits in tissues, turning the skin and the whites of the eyes yellow. Jaundice is not subtle once it is present, but in its early stages, before the yellowing becomes dramatic, it can be easy to miss or to attribute to other causes like lighting conditions, as Carol did. The best place to check for early jaundice is in the whites of the eyes in natural daylight. Any yellowish tinge, even mild, warrants immediate medical evaluation. Early jaundice may also manifest as the urine becoming darker, turning amber or brownish, because the kidneys are attempting to excrete the excess bilirubin that the liver cannot process, and the stool may become paler than normal, turning clay-colored or pale gray, because the bile that normally gives stool its brown color is not reaching the intestines in adequate amounts. Jaundice accompanied by abdominal pain and fever can indicate a bile duct infection or obstruction that requires emergency medical care. Jaundice of any kind should never be watched and waited on at home. It requires same-day or next-day medical evaluation without exception. Sign number 3 is abdominal swelling, specifically a distension of the abdomen that comes from fluid accumulating inside the abdominal cavity. This condition is called ascites, and it is one of the most significant signs of advanced liver disease. In a healthy liver, the production of albumin keeps fluid properly contained within blood vessels. When severe liver damage reduces albumin production, fluid leaks out of the blood vessels into the surrounding abdominal cavity. Additionally, damaged liver tissue creates increased resistance to blood flow through the liver, a condition called portal hypertension, which further promotes fluid accumulation in the abdomen. Ascites typically presents as a progressive swelling of the abdomen that makes the belly look and feel full and distended, sometimes dramatically so. Patients describe a sensation of bloating, pressure, and discomfort. Clothes that fit normally around the waist no longer button. The abdomen feels tight and heavy. In advanced cases, the fluid accumulation can be massive, many liters, causing significant discomfort, difficulty breathing because the fluid pushes up against the diaphragm, and reduced appetite because the distended abdomen compresses the stomach. Ascites is a serious sign indicating significant liver damage, and it requires prompt medical evaluation. Treatment typically involves dietary sodium restriction, diuretic medications to promote fluid excretion, and in some cases, drainage of the fluid through a procedure called paracentesis. But the underlying liver disease driving the ascites must also be treated, which requires a formal diagnosis and a specialist's care. Sign number 4 is one that I think about every time I examine a patient and notice it, because it is so visible and yet so frequently overlooked or misattributed. It is changes in the skin, specifically a cluster of skin findings that are directly caused by liver dysfunction. The first is spider angiomas, small spider-shaped clusters of dilated blood vessels near the surface of the skin that radiate outward from a central point, like the legs of a spider. They typically appear on the chest, face, arms, and upper body. In small numbers, spider angiomas can be completely normal. Most people have a few. But finding more than 5 or 6, or noticing that new ones are appearing, is a sign that the liver is not properly metabolizing estrogen, because excess estrogen causes blood vessel dilation. The second skin finding is palmar erythema, a reddening of the palms of the hands, particularly at the base of the thumb and the outer edge of the palm. This also results from hormonal imbalances caused by impaired liver function. The third is easy bruising, the skin bruises from minor contact that would not have caused bruising previously because the liver is not producing adequate clotting factors. The fourth, and the one that Carol experienced, is generalized itching without an obvious rash. When bile salts accumulate in the blood due to impaired liver function, they deposit in the skin and cause intense itching that is often worse at night. This is similar to the uremic pruritus we discussed in our kidney video. And in both cases, the itching looks like nothing on the surface while representing significant organ dysfunction underneath. If you are experiencing any combination of these skin findings, new spider-like blood vessel clusters, persistently red palms, unexplained easy bruising, or generalized itching without a visible cause, please bring all of them to your doctor's attention together, because individually each one has other explanations. Together they tell a liver story. Sign number 5 is something that happens in the digestive system, and that is frequently dismissed as simple stomach trouble, irritable bowel, or the natural changes of aging in the digestive tract. I am talking about persistent nausea, loss of appetite, and changes in digestion that have been going on for weeks or months rather than days. When the liver is not functioning properly, several things happen in the digestive system simultaneously. Bile production and flow becomes impaired, and without adequate bile, the digestion of fats becomes difficult and uncomfortable. Undigested fats in the intestine cause bloating, cramping, and changes in bowel habits. The accumulation of toxins that a healthy liver would have cleared, including ammonia from protein metabolism, affects the gut-brain axis in ways that produce persistent nausea and reduced appetite. And as liver disease progresses, portal hypertension can cause varices, dilated, fragile blood vessels in the walls of the esophagus and stomach that bleed easily and cause additional digestive symptoms. Patients with early liver disease often describe months of feeling vaguely off, not seriously ill, but just not right. Food that used to appeal to them has lost its appeal. They feel mildly nauseous in the mornings. Their digestion is unpredictable. They have lost weight without trying to, not dramatic weight loss, but a gradual unintended loss of 5 or 10 pounds over several months. This cluster of digestive symptoms, nausea, reduced appetite, unintended weight loss, and vague abdominal discomfort, particularly in the upper right quadrant, is a pattern I take very seriously in any patient over 60. Because in the context of the other signs we have discussed, it completes a picture that demands liver evaluation. Sign number 6 is one of the most alarming and least expected signs of liver disease, and it is cognitive. It is changes in mental function, concentration, memory, and behavior that are caused by the brain being exposed to toxins the liver can no longer clear. This condition is called hepatic encephalopathy, and even in its mild early stages, before it becomes the dramatic confusion and disorientation of advanced cases, it produces subtle but real changes that patients and their families often notice but do not connect to the liver. In mild hepatic encephalopathy, patients describe difficulty concentrating. Tasks that used to be mentally easy now require significant effort. Their thinking feels slower. Their memory for recent events becomes less reliable. They may become more irritable, more anxious, or more withdrawn than their normal personality. Their sleep pattern may reverse, feeling drowsy during the day and wakeful at night. Family members sometimes describe a parent or spouse as seeming not quite themselves without being able to identify exactly what has changed. This cognitive change happens because the liver normally converts ammonia, a byproduct of protein metabolism, into urea, which is safely excreted by the kidneys. When the liver cannot perform this conversion adequately, ammonia accumulates in the bloodstream and crosses into the brain, where it disrupts normal neurological function. In someone over 60, where cognitive changes might be attributed to normal aging or the beginning of dementia, mild hepatic encephalopathy is easily missed. Which is why I want you to know, if you or someone you love has noticed a pattern of increasing cognitive fog, personality change, sleep reversal, and mental slowing, particularly in the presence of any of the other 5 signs I have described today, liver function testing is essential and urgent, so let us bring all 6 together one final time. Profound persistent fatigue that does not respond to rest. Yellowing of the skin or whites of the eyes, jaundice, along with dark urine and pale stool. Abdominal swelling from fluid accumulation, ascites. Skin changes including spider angiomas, red palms, easy bruising, and persistent itching. Digestive disturbances including persistent nausea, loss of appetite, and unintended weight loss. And cognitive changes including mental fog, personality shifts, and sleep reversal. These are the 6 signs, and I want to be completely clear. You do not need all 6 to be concerned. Even 2 or 3 of these signs appearing together in a person over 60 warrants prompt liver evaluation. The tests involved are not complicated. A simple blood panel called a liver function test or hepatic panel measures several enzymes and proteins that reveal liver health: ALT, AST, alkaline phosphatase, bilirubin, albumin, and total protein. An abdominal ultrasound can visualize the liver directly, assessing its size, texture, and the presence of structural abnormalities or fluid. These tests are widely available, generally covered by insurance, and can be ordered at a routine appointment. They can detect liver disease years before symptoms become severe, at a stage where meaningful intervention is still possible. Because unlike the kidneys, the liver does have some capacity for regeneration when the underlying cause of damage is identified and addressed. Caught early enough, alcoholic liver disease can be reversed with sobriety. Non-alcoholic fatty liver disease, which is now the most common liver disease in America and is closely linked to obesity, diabetes, and high fructose diets, can be significantly improved with dietary changes and weight loss. Autoimmune liver conditions respond to immunosuppressive treatment. Viral hepatitis is now treatable with highly effective antiviral medications. The window for meaningful intervention is real, but it requires recognition of the warning signs and the willingness to act on them. I want to close by coming back to Carol. After her diagnosis, Carol made remarkable changes. She modified her diet dramatically, reducing processed foods, refined carbohydrates, and added sugars that had been contributing to the non-alcoholic fatty liver disease driving her condition. She began working with a hepatologist, a liver specialist, who guided her treatment. She lost 22 pounds over the following year. At her most recent appointment, her liver function tests had improved significantly. The disease has not been reversed, The scarring that occurred before her diagnosis is permanent, but its progression has slowed dramatically. And Carol told me something at that appointment that I want to share with you. She said, "Dr. Black, I am angry that I did not know sooner, but I am grateful that I know now. And I am going to make sure everyone I love knows these signs." She has shared her story with her sister, her two adult daughters, her closest friends, because she understands now that the cost of not knowing these signs is not abstract. It is measured in years of silent damage, in scarring that did not have to happen, in a window for intervention that closed before anyone knew it was open. You now know the 6 signs. You know what to look for. Please do not let that knowledge sit unused. Check in with your body, talk to your doctor, share this video with someone you love. I am Dr. Sienna Black. Thank you for watching Healthy After 60. Hit the like button if this helped you today. Subscribe for new health videos every single week, and I will see you in the next one. Your liver has been protecting you silently your whole life. It is time to return the favor. Before I truly close today, I want to spend a few more minutes on something that I think is genuinely important, and that does not get discussed enough in the context of liver disease. And that is the question of who is actually at risk. Because there is a widespread cultural assumption that liver disease is primarily a problem for people who drink heavily. And while alcohol is absolutely a significant cause of liver disease, alcoholic liver disease remains one of the leading causes of liver-related death in the United States. The reality of liver disease in 2025 is far more complex and affects far more people than that narrow understanding suggests. The condition that I am most concerned about in my patients over 60, the condition that I believe represents the largest and most under-recognized liver health crisis in America right now, is non-alcoholic fatty liver disease, NAFLD. Non-alcoholic fatty liver disease is exactly what the name suggests. The accumulation of excess fat in liver cells in people who drink little or no alcohol, and it is shockingly common. Current estimates suggest that approximately 25% of the global adult population has non-alcoholic fatty liver disease. And in the United States, among adults over 60, the prevalence is even higher, particularly among those with obesity, type 2 diabetes, high blood pressure, or high triglycerides. You can have non-alcoholic fatty liver disease and feel completely fine for years. The fat accumulation in the early stages, called simple steatosis, is largely benign and reversible with lifestyle changes. But in approximately 20% of people with simple fatty liver, the condition progresses to a more inflammatory and damaging form called non-alcoholic steatohepatitis, NASH. And NASH can progress to cirrhosis, permanent liver scarring, and in some cases to liver cancer. The risk factors for non-alcoholic fatty liver disease are the same risk factors that are extremely common in Americans over 60: overweight or obesity, type 2 diabetes or insulin resistance, high triglycerides, high blood pressure, metabolic syndrome. The cluster of these conditions together, a diet high in refined carbohydrates and added sugars, particularly high fructose corn syrup, which is present in enormous quantities in processed American food, and which the liver converts directly to fat with unusual efficiency. If you have one or more of these risk factors and you have never discussed your liver health with your doctor, please bring it up at your next appointment. Ask for a liver function panel. Ask whether an ultrasound is appropriate. Because non-alcoholic fatty liver disease caught early, before significant inflammation and scarring have occurred, is a highly manageable condition. The treatment is not a medication. The treatment is lifestyle change. Losing as little as 7 to 10% of body weight has been shown in clinical studies to significantly reduce liver fat and improve liver enzyme levels. Reducing refined carbohydrates and added sugars, particularly sugary drinks and processed foods containing high fructose corn syrup, directly reduces the substrate the liver uses to manufacture fat. Increasing physical activity improves insulin sensitivity and reduces the metabolic drivers of fat accumulation in the liver. These are changes that are entirely within your control, but they require knowing that the risk is real and that your liver deserves your attention. I also want to address the question of medications and the liver, because this is an area where many of my older patients are unknowingly creating additional liver burden without realizing it. Your liver is responsible for metabolizing the majority of medications you take. And many commonly used medications, including some that are available over the counter without a prescription, can cause liver stress or damage when taken in high doses or over extended periods. Acetaminophen, Tylenol, is one of the most important examples. Acetaminophen is the most widely used pain reliever in America, and in appropriate doses, it is safe for most people. But it is also the leading cause of acute liver failure in the United States, primarily from unintentional overdose, which happens when people take multiple medications that contain acetaminophen without realizing it. Many cold medicines, sleep aids, and combination pain relievers contain acetaminophen in addition to other ingredients. If you are taking regular acetaminophen for joint pain or arthritis and also taking combination cold or sleep medications that contain it, you may be consuming significantly more than you realize. The recommended maximum dose is 4 grams per day for healthy adults and 2 grams per day for people with liver disease or heavy alcohol use. Statins, cholesterol-lowering medications that are widely prescribed after 60, can occasionally cause liver enzyme elevations in a small percentage of patients and should be monitored with periodic liver function tests as your doctor recommends. Certain blood pressure medications, diabetes medications, and even high-dose supplements including niacin, vitamin A in excess, and some herbal products marketed for weight loss or energy can place additional burden on the liver. I am not telling you to stop taking your prescribed medications. Please never do that without consulting your doctor. I am asking you to be aware that everything you take passes through your liver, and that a liver already under stress from disease or age has less reserve to handle additional medication burden. Talk to your doctor about all the medications and supplements you take, including over-the-counter products and herbal supplements, and ask specifically whether any of them could be affecting your liver health. There is one final thing I want to leave you with today, and it is a message I feel strongly about giving to every person over 60 who watches this channel. You live in a medical system that is extraordinarily good at treating crises, at stabilizing acute emergencies, at managing advanced disease once it has declared itself loudly and unmistakably. But that same system, through no fault of individual doctors who are doing their best within real constraints of time and resources, is not always good at the quiet, ongoing conversation about early warning signs and preventive monitoring that could catch diseases like liver disease at stages where intervention is truly transformative. Which means that you, as a patient, as a person who lives inside your own body and knows it better than anyone else, have a responsibility to yourself that your medical system cannot fully fulfill on your behalf. The responsibility of paying attention, of noticing when something has changed, of bringing those changes to medical attention even when they feel small or embarrassing or like they are probably nothing. Carol's liver disease was not caught earlier because nobody asked her the right questions and she did not know to volunteer the information. You now know the information. You know the 6 signs. Use that knowledge actively. Check in with your body, notice changes, speak up. Advocate for the tests that can reveal what is happening inside the organs that are running silently in the background, keeping you alive. Your liver has been working for you every single day of your life without asking for anything in return. The least you can do is pay attention when it finally asks. I am Dr. Sienna Black. Take good care of yourself. I will see you in the next video.